It's the Metro on WDET. I'm Robyn Vincent. We begin in an emergency room. A chorus of coughs and sneezes fills the air, and your kid has a fever. So you wait and you worry. 4 months later, you get a call from the health department. Your infant was exposed to measles that night. Now you're looking at weeks of medical monitoring and the anxiety that comes with it. That's what happened to families at a hospital in Oakland County last December. And it got me thinking about something. What does it actually cost when we have to do manually what vaccination used to do automatically? In Washtenaw County, health officials have spent close to $100,000 containing 7 measles cases. Now, that's more than $14,000 per case. And here's the thing. The system worked. They contained the outbreak, did the contact tracing, and prevented it from exploding into hundreds of cases. But think about what that means. We're spending enormous resources to achieve what used to happen easily through herd immunity. Oakland County had 2 measles cases last year, and they handled them well. But now they're spending an extra $300,000 on vaccines. All while vaccination rates continue dropping. Kate Guzmán oversees the Oakland County Health Division, and she joins me now. Kate, welcome back.
Thank you. Good morning.
Let's start with that December case that I mentioned, if we could. A child at the emergency room on December 7th. Paint the picture for us. What was happening that night, and what was that family's story?
So without disclosing real details about the family, because I would hate to disclose any private information, when I'll speak in general terms of a symptomatic child, right? And so just imagine this is the emergency room without the exact details of that case. And so a family has a child with a rash breaking out in combination with a fever and a cough. They head to the emergency room. Their child might be too young to wear a mask comfortably or consistently. If you have a toddler or an infant, you can imagine how difficult it is to put a mask on your child. Impossible, right? And so you enter the emergency room and you're waiting and waiting to be seen, and your child is coughing and uncomfortable while you're waiting in that waiting room. And, coming into the examination room in the emergency room, even the physicians are maybe not thinking it's measles right away. And so then there's continued exposure in the emergency room, in the examination rooms, before finally settling upon this is potentially measles. We need to get this family in an isolation room and in isolation, and then sent home, right, to be treated, or not to be treated, but to recover at home. So all of those patients that were also seeking care at the emergency room were exposed to measles during that time frame. If they were not vaccinated, the likelihood of contracting measles from that child was incredibly high.
Yeah.
Luckily, in a medical setting, we have the capacity to check the registers and see who was there, patient-wise. We won't necessarily know who was there in terms of guests and visitors, but we know what staff were working and we know what patients were seen. So on a contract tracing level, we as the health division can actually contact each person individually and say, on this day, you were exposed to measles. Let's find out your vaccination status. Hopefully you're within the window where we can get you a prophylactic vaccine or even immunoglobulin, if that would be beneficial to you. But best case scenario, all of the staff are vaccinated, so we don't have to worry about them, and everyone in that waiting room is vaccinated, so we don't have to worry about them.
So that's a window into the kinds of conversations that you're having with families who got the call saying that their infants were exposed to measles. What does it mean for a family's life?
Interesting. If your child is in school or daycare and they're not vaccinated and they were exposed to measles, your child may not return to school or daycare for 21 days.
Ouch.
It's a huge disruption to a family's life.
Yeah.
Because imagine 2 parents, 1 parent trying to navigate daycare, solutions, taking time off work. it is a big impact to that family. 21 days, 3 weeks of not being able to return to school or childcare.
And then, of course, there are the so-called invisible people who are affected. I mean, the people who can't really protect themselves. I mean, help us understand what a measles exposure means for, let's say, a child with cancer or a pregnant woman or an infant too young for vaccines.
Yeah, I love this conversation, Robyn, because really that's what our herd immunity is meant to do. It's meant to not only just raise our coverage for the whole community, but it protects those individuals that can't get the vaccine, or if they do receive the vaccine, they don't mount an adequate immune response. And so that's what we see in some immune-compromised individuals, that even though they can receive the vaccine, it doesn't cover them as well as it may cover a healthy individual, or in some people, they just may not receive the vaccine at all. And those people, unfortunately, not only may they not get coverage from the vaccine, but they're also the most likely to get severe complications from the disease. And so that's when we're really worried about pneumonia, first of all. That's the most common complication of a measles infection because it is a respiratory virus. But worst case scenario, the virus moves to the brain and becomes a neurological issue where we see swelling of the brain. And that's where we see those longer term learning disabilities, developmental disorders, loss of hearing, difficulty with cognitive function because we've got this encephalitis or brain swelling from the virus. And those effects sometimes don't show up right away. Those are longer term. We might see them years later as a subsequent effect of a measles infection.
So what you're saying is measles is a really serious illness and it's an insidious one. And it's something that because we have thought of this as being an eradicated disease, I think some of the things you're saying right now might surprise some people because this hasn't been a part of the conversation more broadly for years.
No, and we're not talking enough about it. I've actually reached out to our senior advisory council at Oakland County, asking them, please share your stories. Share your stories of what it was like as a child to have measles, perhaps.
Meaning you're talking about folks who are like 70 years old and above.
Absolutely. Or even if you remember the relief you felt as a parent when that vaccine came out in 1963. I need our more senior residents to share those stories, to share what it felt like to have that relief that your child will not get measles and might not die from this disease that is now preventable.
Well, I think I told you in a previous conversation, Kate, that my mom has recalled being very young and the measles vaccine coming out and her parents crying about it out of sheer relief. So we've been talking about how people are affected and some of the unseen folks who feel this. I want to also think about something else that's unseen, and that is the systems that are at work when this happens. So it has me wondering how many of your roughly, 450 employees get pulled into containing, let's say, one measles case. What does that look like operationally?
Oh, I would love to paint this picture for you because I do think, Robyn, that public health is so diligent behind the scenes. We're working every day and no one really understands what's happening. So when we have notification of a suspect case, and that's typically a doctor's office or a hospital calling us saying, I need to submit this specimen for measles to the State Bureau of Laboratory because I suspect based on symptoms and based on rash, based on exposure, that this is a case of measles. From the moment we get that call, the activation starts. And so we'll immediately engage our communicable disease nurses. The nurses are the ones that call the case, and they will start to find out first and foremost a list of people that they have been in contact with and places they have been during their contagious period. So it's an interview, an investigation of sorts. That gets escalated to epidemiologists who work further to definitively say, yes, this is measles. We're confirming this is measles. At that point, we're pulling in the clinical nursing team. We're pulling in an outreach nursing team. And we're also pulling in a really behind-the-scenes nursing team. That's the immunization action plan. They don't actually vaccinate people. They are watching vaccine rates and helping providers in the community vaccinate people. So we're pulling lists of kids that don't have vaccine coverage. We're contacting them via mail and calls. Those are called vaccine recalls. So we pull those by zip code. We can pull those by antigen. So we'll look at measles specific. All the kids that are behind on measles, they're all getting a phone call. They're all getting a letter, whether or not they've been exposed, right? So we've got this efforts in addition to the efforts contacting the people who are actually exposed. Now, you can't forget the communications team, because simultaneously we're elevating the message on social media. Make sure you're getting vaccinated. Here's the list of locations. We're also contacting our traditional media. We're getting someone like myself, the health officer, and the medical director involved so that we can come out, make sure the public is confident in the action that's being taken. We're talking about vaccines, we're talking about the exposure sites, and we're handling so many calls. So then in the background, we have nurses answering a helpline. The Oakland Connects helpline is our 1-800 number, and they're just fielding questions and questions and questions from the worried well that were at those exposure locations, and then the genuinely impacted and exposed individuals that then get rerouted right back to the communicable disease unit. So when you talk about a team, I'm saying 25 to 30 people easily activated with one case.
Okay, so the orchestra plays and conductor Guzmán
Absolutely
is at the helm here. I'm wondering also, so we're talking about how this is pulling people away from their regular jobs, their regular duties. And this is now giving us more of a window into why this is costing more money. And I'm thinking about Washtenaw County, which, as I mentioned, spent $100,000 on 7 cases. And again, that's over $14,000 per case. Now, meanwhile, Kate, what does it cost to vaccinate a child? Walk me through that math.
Yeah, it's much more affordable. Clearly, the vaccine, the MMR vaccine, the measles, mumps, and rubella vaccine costs us at Oakland County at cost $76 per dose, right? We have a vaccination infrastructure that clearly contributes to the cost. So we have a biologics team. That's the team that is in control of our refrigerators and freezers. They're monitoring the temperatures every day. So we've got the overhead just of keeping these vaccines safe. Then we have the clinical nurses that are administering the vaccine and the overhead that it costs to keep a clinical team of vaccinators. But honestly, $76 plus a couple hundred in overhead. So we're talking maybe $300 total to vaccinate a child. When you really think about it, with 1 dose of the MMR vaccine, it would be double that for the second dose. 2 doses completes a series of measles vaccination.
So we're talking about essentially $300 versus potentially $14,000 per case per child here. So a huge disparity.
It is a giant disparity. Not to mention, Robyn, it's not just about the money that we can quantify, but what I look at as the health officer is I'm looking at what activities are my staff doing on a daily basis that they're being pulled from, that they're being diverted from now to really focus on measles. So if I have an initiative that I'm trying to launch, for example, infant mortality, and I'm asking people to do some extra work on infant mortality today because it's a priority that we have as part of our strategic plan, all of that stops because we're all focused on measles. And so a different priority such as infant mortality, because it's not a crisis in this moment, stalls out. And the activity that we have going, the momentum we have going forward on that just plateaus until we can refocus, move out of outbreak mode, refocus, and get back to activities that are in our strategic plan and that are very important for the health of our community.
So you're saying the ripple effects from an outbreak are so much wider and deeper than people might think about. We're not just talking about the costs of the outbreak itself, and we're not just talking about the community or personal costs from the disease itself. We're talking about the other things, the other important issues that you then have to stop paying attention to and have to press pause on, and what that means for a community and public health more broadly.
Yes, absolutely. And it's not just the money that I'm diverting, it's not just the attention and the activities that I'm diverting, it's also the budgetary line items, right? And so I'm forced to buy immunoglobulin, which is very expensive. The immunoglobulin can protect an individual from measles within 5 days of exposure. It's meant for severe immune-compromised individuals. It's very expensive. For 1 vial, which only protects about a 50-pound kid, it's $500.
It's the Metro on WDET, Detroit Public Radio. I'm Robyn Vincent. My guest is Kate Guzmán, Oakland County Health Officer. We're talking about the hidden costs of outbreaks as measles cases in Michigan and across the country continue to rise. And when we come back, we're going to look at what that means in the classroom and beyond. It's the Metro. Stay with us. It's the Metro on WDET. I'm Robyn Vincent. My guest today is Kate Guzmán, Oakland County Health Officer, and we've been talking about the hidden costs of outbreaks, and that's because measles cases in particular are on the rise in Michigan and across the country. Kate, help us picture what happens now when measles hit an elementary school with, say, 400 kids. I mean, we've talked about what it means if you're exposed, let's say, in an emergency room. And we've talked about how your team springs into action and you've got this whole orchestra playing this song with you conducting. Now, what is going on at the school? What's the operational reality for everyone involved?
Oh, at a school level, this is their nightmare. Any infectious disease outbreak at a school is just so unfortunate because teachers, principals, school administrators, this is not why they went into this job. They're not trained for this. We help them as much as we can. Our communicable disease team is amazing, walks the school step by step through what they need to do. But honestly, because of especially elementary schools, because you've got these classroom settings where they're moving to specials, say art and music and gym, they're in the cafeteria, it's really hard to limit the outbreak to just a classroom. So unfortunately, we typically have to widen it to the whole school because it's hard to say, yes, I know it's hard to say this child was in the lunchroom who was in the lunchroom for 2 hours after. I mean, it's very hard to say it's just, Mrs. Guzmán's classroom 2A is all in quarantine. And so within that school, any child who goes to that school who is not vaccinated against measles has to stay home for 21 days. So you may ask, I thought a measles vaccine was required for school, and it is, but we are allowed in Michigan, and this is a state-by-state legislation. In Michigan, families are allowed to choose not to vaccinate, and they may receive a vaccine exemption, also called a vaccine waiver.
Okay.
Mm-hmm. And so that is a document that you receive through the health department. Once a family undergoes a short training and has a conversation with a waiver nurse or a vaccine exemption nurse, and it's a mutual decision, the family decides this is not right for us. We won't be vaccinating our child against measles today.
What does that training look like? I'm just wondering, is that a bunch of pleading and nurses getting down on their knees and giving a lot of disclaimers like, please don't do this?
It's fascinating. I think that our waiver nurses are gems in the health division, I'll be honest. Typically, there are more seasoned, experienced nurses who have seen just about everything, have spoken to so many families throughout their careers. They're well-versed in what it's like to have this type of sensitive conversation. In our health division, it is honestly a discussion. It feels like we're pleading. We're not. We're more just really hoping to find a common ground, find what it is, what exactly is the barrier for that family, and honing in on that to provide the education around that specific issue. Because typically we don't find families that are just against all vaccines in general, just philosophically, that they'll come in, we just agree to disagree and sign the paper. But families that come in that have a general safety concern or have a real question about a certain component, maybe it's thimerosal in the MMR vaccine because they're still hearing about those old studies saying that thimerosal causes autism. And so when they come in with that concern, for example, we can really look at, here's the data, here's why that study was dispelled so long ago, and this isn't real, this isn't true, here's the science, here's the facts. And many times, Robyn, what we end up doing is we end up coming to a common ground with that family where we say, let's just start with one today. You may be concerned to get all 6 that your child needs today, but let's start with one. Which one are you most comfortable with? And typically if we can move them from 1 to 2 and then they come back, they're getting their 3rd and their 4th, and we're on a good, we're making progress to getting that child fully up to date.
So the nurses who are doing this are taking on more of a subversive role. They see this vaccine waiver appointment as an opportunity to open the door and say, okay, so you feel strongly about not getting your kid vaccinated for this certain illness, but what about this one? What about that one? You're seeing these moments as really important opportunities to have FaceTime with parents and to give them more information that you hope might shift their perspective on things. What is the vaccine waiver rate? And forgive me if I'm putting you too much on the spot. In Oakland County, I'm wondering what percentage of people are...
No, it's a great question. It's about 7%. And that's not truly updated. That was at the beginning of this school year. The reporting timeframes for schools, it's a little complicated. And so we don't have the up-to-date vaccine waiver data for Oakland County schools. But going into the school year, we were at about 7%, which is a little below the state average. We're right on par. It's about average. We're seeing it rise a little bit. We're expecting that this season we will see an overall increase because we can tell by the number of waivers that we are performing in our health division that we've seen an increase in waivers. Absolutely. We've definitely talking about diverting staff. So this team of waiver nurses or exemption nurses, the same nurses that answer our Oakland County helpline. And so they're the experienced nurses that just answer every question. And then on the side, they also do waivers. Well, now it's not on the side, they also do waivers. Now they do vaccine exemptions and they squeeze in the helpline when they can. So on the side, they do the helpline because exemption appointments are in demand and our nurses are very busy. We don't rush these appointments either. That's another important point. While we may schedule them for a half an hour, they do, if it's a successful appointment, they go longer because the conversation is robust and we're providing great education.
I mean, your system, what you're describing sounds very hopeful, and it has been successful when we look at the 2 measles cases that Oakland County was able to contain. But Kate, you serve 1.29 million people, and that's in a state where vaccination rates dropped from 89% to 66%.
It's overwhelming.
At what point does this become, I don't want to say a real issue because it is a real issue, but I'm wondering, I always ask you this, and I'm curious in this moment how the conversations that you're having with other health leaders are continuing to change in this moment.
Well, we're definitely evolving. What it's forcing us to do is look at some of our programs that are not mandated and are not essential. And I hate to even talk about some of these programs as non-essential because to me, thinking about them, what we're doing in the community is essential. But thinking through some of our, home visiting programs that maybe could be done by a partner agency that's not local health, a program that is not defined in the local health code. It's not one of our essential mandated services. We're forced to make these decisions now because I need more nurses vaccinating and I need more nurses doing exemption visits and I need more nurses doing case investigation and contact tracing. It's a shame, but that's where we all are, even when I talk to my colleagues in local health departments nearby.
Do your nurses who are having these discussions with parents about vaccine waivers, do they bring up some of these broader, what I would call societal costs?
No. And the visits that I've been lucky enough to sit in on, they're very focused on that family. Because honestly, as a parent, do you really care what it's costing the local health department? No, you really just care about your child and making sure that they're safe. And you're anxious about the decisions that you're forced to make as a parent because you're hearing all this conflicting information. And so you sit down in this chair across from a nurse. You're expecting a battle or an argument. So your cortisol's high, your adrenaline's pumping. And then you sit down in front of the nicest nurse that you'll ever meet. It's totally de-escalated. And you might even shed a few tears because this nurse is so warm and caring and cares about your child as much as you do.
But as much as you are doing in Oakland County, what we have to acknowledge is that we're all very connected.
Mm-hmm.
And Oakland County is now recommending early infant vaccination, and that's because of Washtenaw County's outbreak. But you can't control what happens in Washtenaw County. Their vaccination rates, their response speed, their resource decisions. So what happens when a neighboring county makes choices that put your residents at risk? Do you have any recourse beyond just reacting?
It's wonderful here in the state of Michigan that we don't think just siloed county by county. So our state health department is incredibly proactive. We have large health officer calls. We have regional ones. And so when Washtenaw County had their first case, the state immediately called together the regional health officer meeting. And we've had meetings every week now. And so this is looking at Wayne County, Macomb County, Oakland, Washtenaw, even Livingston, Monroe, just our Southeast Michigan area, right? We're coming together, and believe it or not, we're sharing resources. So we're on immediately. How much vaccine do you have in your fridges and freezers? How much do you have? Do you have immune globulin? How long will it take you to get immune globulin? We've loaned immune globulin out to neighboring counties now, knowing that they'll pay us back and we'll get that immune globulin back, but we're sharing resources. We're also making sure that we're following the same guidelines. And so when we're saying we're vaccinating infants early, we're all doing it and we're trying to do it on the same day, make this announcement. So we're all doing this, we're together. And, clearly we say public health has no borders.
Yeah.
And Oakland County never turns anyone away for geographic boundaries.
I'm wondering if there is some feeling of added pressure when we think about Oakland County versus other counties where there's a lot of concentrated poverty. And Oakland County is, by and large, a rich county. And I'm wondering what that looks like when it comes to you working with counties like Wayne County, for example, where there's a lot less money in the coffers.
It's interesting because I recognize how lucky I am. I have 6 epidemiologists on staff, which is almost unheard of for local public health. Now, if you look at the ratio of epidemiologists to population, we're still below where we should be, looking at best practice. However, having 6 epidemiologists that can provide this, having almost 100 nurses, we are very fortunate in Oakland County, and I'm well aware of that when I sit on these meetings and offer our resources. And something to think about, though, is that even though a county may have more pockets of poverty, that doesn't mean their vaccination rates are lower. So we really have to look at who is choosing not to vaccinate, because you'd be surprised by the pockets of non-vaccinators in our community are not necessarily based where you would imagine the poverty is.
That's a very good point. I mean, you mentioned as well that it's about 7% of residents who are asking for vaccine waivers in Oakland County, and the Michigan average is 6%. Washtenaw County, it's about 5% of residents who are asking. So the income, the affluent nature of many of the households in Oakland County, that does not equal folks who have high vaccination rates. And that's what you're saying here.
Yeah, and it's interesting when you really look at it, because for a family that is more affluent, that 21-day exclusion period from school doesn't hit them as hard. It's not a real selling point when we're meeting with them, because they may have more flexible working lives, or they can afford to pay someone to come into their home for childcare. They have the resources to successfully navigate that 21-day quarantine.
That's a good point. I mean, one more question I have here on the money. Oakland County approved an extra $300,000 for vaccines, and that's while federal public health funding is getting cut. Where does outbreak response money come from when prevention fails?
It depends on the outbreak. And so we do see money coming from the state. So they do take federal money and send it back out to the health departments. Last year, for example, we had a small pot of money that was given to us specifically for measles from the state. Every county had an allocation, and that was meant to be very proactive and start working on measles. And so we do get extra funds during outbreaks. We saw that a lot during COVID. We had lots of COVID dollars coming our way so that we could hire additional people to do contact tracing, case investigation, and that sort. And even with, if you remember Mpox, which monkeypox, if you remember that, we also had funding coming to us specifically for that, for vaccines, for vaccination outreaches. And so when there are significant outbreaks, it is recognized on a state level and money is provided to us. This year could be different. We're not exactly sure what to expect, which is just based on federal policy right now. And so that's why I'm looking very closely at my programs and my budget and where can I reallocate positions and funding to ensure that we have enough money for this.
So does that mean that some things that you're doing right now could be on the chopping block?
For sure. Absolutely.
Kate, here's what really strikes me. The U.S. just had over 1,900 measles cases in 2025. That's the highest since 1992. Most parents making vaccination decisions today were protected by vaccines as children. So they're not choosing against measles vaccines because they survived measles. They're choosing against them because vaccines worked so well, they never had to fear measles. How do you explain to parents that the safety that they grew up with came from the very thing they're now questioning?
We talk a lot about the process, the testing process. And so we do provide a lot of education to our families that are coming in with concerns about the 3 phases of the clinical trials that the FDA oversees before vaccines are approved. We used to talk about the ACIP process. We don't talk about that as much right now, but we're still talking about clinical trials and what that means.
What
in
process?
The safety. Yeah, so the FDA, so the Food and Drug Administration, approves vaccines by safety regulations. And the Advisory Committee on Immunization Practices was the committee that it's at a standstill right now, but it was advising the CDC on how best to utilize the vaccine. So it provided the recommendations once the FDA approved a vaccine that it's safe and effective, then the ACIP comes in and decides, as a panel of experts, and then they decide how is the best way to roll this out. Is this a vaccine is this a disease that has a potential for death and severe illness? They're looking at the safety, the efficacy. They're looking at how communicable the disease is so that they can consider how it's rolled out across the U.S. And from the ACIP, then the CDC gives their stamp of approval and administers their recommendations for vaccine use. And so when I say that that's stalled out, that's because the ACIP is in limbo right now after a federal court ruled that the members that RFK Jr. put in place were unqualified. So we're on a pause on the ACIP, but the FDA is still still going strong, and we still talk about safety based on the FDA clinical trial process.
That's a lot, Kate.
That's a lot. I'm sorry.
No, thank you for explaining that. I mean, essentially what you're saying is something that you and I talk about a lot, which is that you are feeling much greater responsibility as a local health leader because the guidance at the top, at the federal level, is stalled, it's quieter, it's back and forth. And so what I'm hearing from you is that you're trying to be a constant force, you and your orchestra and many other health leaders right now at the local level.
That's exactly right, Robyn.
Kate Guzmán, Oakland County Health Officer. Always so great to have you on the show, Kate.
Thank you so much.
It's the Metro on WDET. I'm Robyn Vincent. Up next, and relatedly, St. Clair County's medical director has been fashioning himself after RFK Jr. We'll find out what that's meant for residents who reside just northeast of the metro area. That's next. Stay with us.